If you are a senior, listen up. I have big changes coming to Medicare in 2025. You don't want to miss this. If you are trying to sign up for Medicare in 2025, you also want to pay attention to these changes because they're going to affect everyone. So, if you are new to this channel, I want you to hit the subscribe button, hit the like button, because all we do is bring you the latest news and updates about Medicare, Medicaid, Social Security, and food stamps, and any personal finance news and assistance that can help seniors save money. Now, I want to hear from you. Where are you watching this video from? Give me your city and state in the comments below. And if you're watching the replay of this video, let me know where you're watching from. So let's get started. So the New York Times is leading this story with big changes coming to Medicare. It's time for you to shop for your Medicare plans because there are big changes coming. A bumper crop of revisions, including stronger drug benefit, means that the plan you were enrolled in 2024 may not be a good fit for you in 2025. That's why you need to pay attention to this. CBS News: seniors will pay more for Medicare in 2025. I'll bring you all the details. And then the Wall Street Journal: Medicare plans are making big changes for 2025. Here's how to navigate them. An estimated 5 million people will either have to get a new Medicare health plan or Part D drug plan as a result of the changes. And then you have Investopia talking about Project 2025 and plans to change Medicare that may affect everyone in 2025. And then finally, this local news organization talking about big changes to Medicare. So the key word here is that there are big changes coming, and I've done the research and I'm bringing you all the latest about this, what you need to know to prepare for Medicare in 2025. So here's an overview. The Inflation Reduction Act of 2022 introduced major Medicare reforms for 2025, focusing on making prescription drugs more affordable. This is the biggest change since Medicare Part D was introduced in 2006. The new $2,000 annual cap to Medicare out of pocket costs ends the confusing donut system where seniors had to pay varying amounts at different coverage phases. And then there's a flexible monthly payment system that has been introduced that will allow your drug costs to be spread throughout the year. And then these changes are universal across Medicare drug plans and are going to affect everybody. These are the highlights. Let's get into the details. There are 12 changes. The first one, a big one, the 2000 out of pocket cap. Once you have reached the 2000 out of pocket spending limit, you are completely covered for the rest of the year. No cost is going to be impacting you after that. This replaces the old system, the complicated system where you had to move through several phases: deductible, initial coverage, donut hole, catastrophic. That is all gone. The cap includes everything you pay yourself: deductibles, co-payments, and your percentage of drug costs, co-insurance. The plan premiums that you pay, your medical plan premiums, are not included in this 2000 cap. So that is a point of clarification. The out-of-pocket cost does not include your premium cost. About 1.7 million Medicare beneficiaries currently spend over $2,000, and this is going to be a lifesaver for them. Now, the next change is the monthly payment plan. The new plan works like a subscription service. Instead of paying hundreds in pharmacy costs upfront, you can spread it over 12 months at least $166.67 per month or less. The monthly cap is calculated by dividing $2,000 by 12 months. And unlike a typical payment plans where they charge interest and fees, Medicare payment plans have no fees. So this is a good addition, and it helps, especially in the January, February timeframe when a lot of people pay upfront costs, including deductible and initial coverage costs. The third change is Medicare Part D premium. The most popular plans are going to see a significant increase despite average decrease. The base premium is going to increase from $36.78, representing a 6% rise. Now, here's my problem with this. This particular cost is going up 6%, but then the cost of living adjustment for food stamps for Social Security is like 2.5%. So as you can see again, government benefit adjustments are lower, and then you go to costs that seniors are facing, like Medicare costs, and here you see an example where it's 6%. So there's a mismatch. That's why the last 10 years, Medicare, Social Security benefits have not caught up with inflation. Most beneficiaries will see an increase limited to about $2 monthly due to federal premium stabilization efforts. Standalone drug plans are actually decreasing on average to 40 monthly, making coverage more affordable. Medicare Advantage plans with drug coverage show significant savings, dropping to $13 on average, a 13% decrease. So there's some good news in some places. Medicare Advantage changes. 60% of enrollee will pay a drug deductible in 2025, up from 21%. That's a huge jump. Average deductible will be decreasing from 59 to 2 will be increasing from 59 to 225 for these plans. That's a big jump. Some supplemental benefits like dental and vision might be reduced or restructured to maintain plan affordability. Medicare is implementing stricter rules about having enough doctors and specialists in the network to ensure real access, and plans might now study how their authorization requirements affect vulnerable members before they implement them. Another change that's coming is mid-year notice. Starting in summer 2025, Medicare Advantage plans must notify their members about unused benefit they've paid for. These notices would detail coverage services like dental work, eye exam, hearing aids that you haven't used yet. They must provide you a clear step on how to access these benefits. This is to help make sure that you use all the benefits you're paying for in your Medicare Advantage plans before they expire. Coming up also is mental health expansion. Medicare now accepts more types of mental health providers, including marriage counselors and addiction specialists. The program is actively recruiting more mental health professionals to improve access to care. Telehealth for mental health became a permanent benefit, not just during COVID era, and plans must verify their listed mental health providers are actually accepting patients to prevent ghost networks. This is a big one. Guide program. The dementia care program expands dramatically from 96 to 390 organizations across the country. Caregivers get access to 24/7 professional support for handling dementia-related challenges. A significant $2,500 yearly allowance helps pay for respite care, giving family caregivers needed breaks. This program specifically targets original Medicare beneficiaries with diagnosed dementia who aren't in nursing homes. Plan consolidation. There's going to be a 26% reduction in plan choices. 5% of Medicare Advantage plan enrollees are terminating. 7% will automatically move to different plans from the same carrier. Major insurers are combining or ending plans, including Aetna, United Care, and Mutual of Omaha. Every state remains and maintains at least 12 plans to ensure that you have more options. So even though plans are consolidating, there's still enough variety in your state to make sure that there's competition and choice. And fewer options make comparing plans much, much easier for seniors who are looking to compare health plans before they make a decision. Now there's authorization changes that are coming. Plans must study how their approval requirements affect seniors who are more vulnerable to care delays. Response time for approval requests cut in half to 7 days by 2026, reducing treatment delays. So that's an aspiration. And authorizations can only verify medical need, not add extra requirements beyond original Medicare requirements. And plans must follow original Medicare coverage rules, preventing arbitrary denials of coverage. The next one is prescription drug negotiations. Medicare gains unprecedented power to negotiate directly with drug manufacturers. The first round of negotiations completed for 10 expensive drugs with lower prices starting in 2026. 15 more drugs are entering negotiations in 2025, expanding potential savings opportunities. And new manufacturer drug program provides additional savings beyond the $2,000 out-of-pocket cap. Now let's talk about Medicare Part B premium, which a lot of seniors are worried about. Medicare Part B monthly premium rises to $185 for most beneficiaries, covering doctor visits and outpatient care. This 6% increase, again, 6% increase affects everyone with Medicare Part B coverage. So Medicare Part B goes up by 6%, but Social Security COLA goes up by 2.5%. You see the gap? That is why some seniors are struggling, because their Social Security check is not catching up to inflation, and the little money they get in the increase gets eaten up by Medicare Part D premium, Part B, which continues to rise every year, and this year is going up by 6%. Higher income beneficiaries, 103,000 annually, pay more based on their income level, and this premium is separate from prescription drug coverage and applies to medical services. Change number 12, which is very exciting, weight loss coverage under Medicare. Medicare now covers weight loss drugs when prescribed for health conditions like heart disease. Wegovy specifically approved for cardiovascular disease patients who are overweight. Coverage expected to expand as FDA approves these medications for other medical conditions. These medications fall under the new $2,000 annual out-of-pocket cost maximum. So it means that if you are under Wegovy, it falls under this out-of-pocket cost, so that you cannot pay more than $2,000. Once you reach that cap, they have to cover you. So next steps, you have to watch out for communication that's going to come from the Medicare administration about changes from your Medicare plan administrator, sending you notices about plan changes and all these big changes that are coming for next year. But of course, you can go to medicare.gov to get more information. You can call the hotline at 1-800-MEDICARE for support, or you can contact your area senior center, area aging center, and all these senior organizations that are helping make Medicare accessible, easy to understand, and make the choices clearer to you. So let me know what you think about these changes that I've covered. What is going to affect you positively? What are you excited about? What is going to affect you negatively? Let me know in the comments. If you're new to this channel, hit the subscribe button, hit the like button, and most importantly, let me know where you're watching this video from, the city and state. List that below. I'm looking forward to interacting with you. Thank you for watching, and until I see you in my next video or on the next live, thank you and have a great day.